morning. You know it's important to take care of your heart. And actually, though, less than 7% of adults in the U.S. have optimal heart health. It only gets worse across the nation and, unfortunately, also here in Arizona, which is why we are bringing in Dr. Ernst von Schwarz, a board-certified cardiologist. Good morning. Thank you for joining us.
Good morning, Whitney. Thanks for having me on.
So we are talking about cardiometabolic health. Can you tell us what that actually means for folks who aren't familiar with the term?
What it means is basically a conglomeration of the risk factors which subsequently will lead to heart disease, which is obesity, overweight, which is high blood pressure or pre-hypertension, and which is diabetes. So these are the main risk factors which sooner or later will lead to hardening of the blood vessels, atherosclerosis, heart attacks, coronary disease, strokes, and so on.
So we said it kind of in the anchor intro here, just a little teaser for folks. How is Arizona doing when it comes to cardiometabolic health rates in our state?
Well, compared to the U.S. in general, Arizona is not doing that bad. So I have the numbers here in front of me. For example, with diabetes, in the U.S., there's a prevalence of 14.7%. Arizona has 10.7%, which is better than the average, but is higher than, for example, California, where I am right now, which is 10.5%. Regard to hypertension, average in the U.S. is almost 50%. Arizona is around 32.5%. California is lower, 25%. So not bad, but not good enough, of course. And with obesity, similarly, U.S. national 42%, Arizona approximately 31%. So Arizona is not doing bad, but not good enough.
So what are some of the factors that lead to some of these heart health issues?
The main thing for us is, there's two things actually. Number one is that those cardiometabolic syndromes usually don't make symptoms. So you don't know if you are pre-diabetic or pre-hypertensive unless you really measure it, because you don't have any symptoms, you don't have any signs. So you basically have to be proactive. Go to your doctor or go to a pharmacy, check your blood pressures regularly and your blood sugars. And the other thing is what we are seeing now, and that's nationwide, is this increased prevalence among children and young adults. 1 in 4 young adults has now what we call pre-diabetes, and pre-hypertension is even higher. Half of the young population has pre-hypertension. And these are conditions which are oftentimes not even treated. Even if you go to the doctor, they don't treat it accordingly, and patients don't take it serious enough. So the main treatment is, of course, lifestyle changes, diet, and exercise.
Okay, as simple as that. It can be hard to do sometimes, especially in our state right now when it is so hot outside. Doctor, thank you so much for joining us. Always happy to talk about this, such an important topic for sure.
Thanks for having me on, Whitney. All the best to you.
Have a good one.